Good afternoon, everybody. Christine Barconi here in the NBC4i Streaming Center, joined by Dr. Gastaldo, Dr. Joseph Gastaldo from Ohio Health, infectious disease expert. And we just had the weekly COVID numbers come out today. We started reporting them, or the Ohio Department of Health started reporting them weekly a few weeks back. And I know you're part of that task force, Dr. Gastaldo. We would see you from time to time on those Zoom meetings that Dr. Vanderhoff would host. We have quite an uptick happening right now nationally. That did happen, and we saw those numbers come out earlier this week, but now we're seeing it here in Ohio. Numbers obviously still low comparatively to the Omicron variant, but what do you make of these new numbers?
Not surprising. I do want to emphasize the word uptick and not surge. So really what we have going on nationally now are sublineages or subvariants. BA.2, there are other cousins of BA.2, and they are more transmissible. And we are seeing this more so in New York State and northeastern New England area. There is more of an uptick in the community, and there is a slight uptick in the hospitalizations. However, everything is context. And in the state of Ohio specifically, if you look at our hospitalizations during the Omicron surge, we are nowhere near that in the setting of the Omicron surge hospitalization. So we really don't know with certainty where this is all going to settle out. However, so far, it does not appear that this is going to result in a hospitalization surge or increasing deaths. And that's what really matters the most when we talk about COVID and vaccines and everything. And really, too, we need to emphasize the fact that it's very different today than what it was last year, 2 years ago. We have the tools available to protect everybody. We have vaccines which are still performing well with a booster in protecting people from dying and being hospitalized. We have testing available at home. And for people who have an at-risk condition, they need to have a plan in place that if they do get COVID, they get access to the outpatient treatments that are available, specifically the pills and the monoclonal antibodies.
All right, so that is all good news. Let's talk about Ohio Health and your hospitals. You guys are the largest hospital system that we have here in Central Ohio. We learned yesterday that the Ohio State Wexner Medical Center, they didn't, as of like a certain point, obviously it changes, minute to minute. They had nobody on a ventilator due to COVID, which is, something that, you guys had been working very hard to get to over the past 2 years. How are things looking at the Ohio Health hospitals, and I'm not sure if you know about the rest of the hospital systems around the state as well, what they're seeing.
Yeah, so if you look at our region and in the state of Ohio, hospitalization numbers are essentially stable. On the ODH website, the numbers have not really changed that much for hospitalized COVID patients. As a state, we're in the 300 range. Here at Riverside, where I'm at now, our hospitalizations are essentially plateaued in the 20 range. I was up in the intensive care unit here at Riverside yesterday, and there was only one person in the intensive care unit with COVID, and that person was not on the ventilator. That's very different than what it was this past winter. This past winter, remember, we had delayed and elective surgeries. We were really stressed from a hospital bed capacity with COVID patients, and we are nowhere near that. I really don't think we're going to be at that point with where we are currently with this uptick in the community.
Well, again, that kind of makes me think like I know healthcare providers, especially nurses in your ICU departments, the taxing amount of stress and work that this pandemic has been for them over the past 2 years, and obviously most recently this winter. What does that feel like? What was I guess, the mood like? Is it kind of like a back to normal? Obviously, an ICU isn't where anybody wants to be, patient wise, but are they back to their normal workload? How is everybody doing mentally? Is this kind of a little bit of a relief?
Yeah, we are in a reprieve. I wouldn't say we're completely back to normal. We are going through a recovery and resiliency plan at Ohio Health, and that's really everywhere in healthcare. As healthcare workers, we were really affected by COVID, obviously, with the stresses of our jobs, but also, too, we really didn't get a break from it because we all had to deal with COVID in our private lives and in our families, just like everybody else, and having your life change because of COVID and how you plan on vacations or worry about your loved ones or your family members. So in healthcare, things are better for healthcare workers. They're not back to normal yet, and we're really focusing on recovery.
Okay. Earlier this week, we had the mask mandate on transportation, the federal mask mandate drop on transportation. John Glenn International Airport, as well as CODA, they dropped their mask mandate enforcements here in Ohio. What is your reaction to that? I know there might be a lawsuit, but as of right now, there really hasn't been.
Yeah, I am a little bit disappointed with the legal ruling that the was unlawful or for whatever reason. You know, when it comes to protecting us, that is the job of public health to protect the citizens. I was supportive in the CDC's extending the mask mandate until May the 3rd because we really wanted to have a handle on what's going on with BA.2. So officially speaking, again, we always want to recommend following the guidance that comes out from local health departments, from the state health department, and also the Centers for Disease Control. And last night, the CDC did have a press release. It is still the CDC recommendation for all people still to wear a mask during public transportation. And I think that is the proper recommendation to do. Obviously, we really want to be on point in telling people to wear the right kind of mask, a well-fitted mask, and the highest quality mask as possible, specifically a KN95 mask or an N95 mask.
Okay. So as we move forward, it hasn't officially happened yet, but do you see the potential of COVID being called or labeled an endemic, something that we are having to deal with, I guess, throughout the history of time as we do other viruses?
Yeah, I do think in our country, we are making slow steps into having this be an endemic type of virus, meaning that it never goes away and there's always different ebbs and flows of hot pockets of COVID. And just the fact that something is endemic does not make it as less dangerous. But I do think we are in a much different situation today. We have vaccines, we have great layers of protection against dying from this. We have treatments available. We have better communication on masks. We're talking more about the ventilation of air, filtration of air, and we know more about how the virus is spread. So it's a much different situation than where we were last year.
I do want to touch on kids and the vaccination because obviously kids have their, their birthdays every single year, and um, as kids start to turn 5, as the pandemic goes on, do you think, and what is your recommendation for parents for making sure that they get the COVID-19 vaccine? Is it still, do you think it's still a priority for people to go out like on their kid's 5th birthday or, the week that they turn 5 to make sure they get it from, children's or their primary care physician?
Absolutely. I'm strongly supportive of children being vaccinated. Right now, we only have vaccines available for 5 to 11-year-old, and those under the age of 5 down to 6 months old, we're still waiting for those vaccine clinical trials to be reviewed. Children are low risk, yes, but low risk is not zero risk. During the Omicron surge, there was a much higher proportion of unvaccinated children being hospitalized compared to vaccinated children. We have to worry about long COVID. Long COVID is something that hopefully we will learn more about, and children can get long COVID. The vaccines are safe. We know that, and it's important that we really get vaccines into children.
Okay. Dr. Gastaldo, anything new that we have not touched on? I know it's been a minute since we've chatted about this, which I think is indicative of our numbers being down, which is
Yeah, I
excellent.
think I think as an infectious disease doctor who's been talking about COVID for a long time and vaccines, we really want to be on point talking to people about boosters. As everybody knows, there is a recommendation for a second booster that's available for people 50 and above. One thing I want to say moving forward is that it's important for people to be up to date on their vaccines. Right now, at this moment in time, the definition of being up to date is only one booster for those people who are not immunocompromised. So the second booster recommendation that came out recently is really what I would consider an optional second booster. We know it's safe, but in the context of who really needs it, as an infectious disease doctor, I'm telling my older patients, those above the age of 60 or 70 to get it. I think those with a longer list of comorbid conditions like obesity, diabetes, hypertension, if you have a longer list of those, you should get it. But I really think for someone who is 51 or 52, who has no comorbid conditions, perhaps they had Omicron, it's less of an urgency for them to get the second booster. Again, the second booster is available. However, getting the second booster is not required at this point in time to really be up to date on your vaccines as defined by the CDC.
Okay, Dr. Gustado, thank you so much. We really appreciate it. All right, guys. So all the latest COVID information is in the story down below. If you're watching on NBC4i.com, you can scroll down. Ben Orner made lots of charts and graphs just to keep everybody up to date and just to be, as transparent as we can as we continue to monitor COVID here in the state of Ohio. As always, thank you so much, Dr. Gustado. We appreciate it.
Thank you, Christine.